The services done by Amrita Kripa Hospital in the villages for past 15 years. It's not a one day to 2 day visit to the villages. Every week our doctor and our entire team visits the villages. They meet, they talk to around 150 patients every time, and they understand their problems. So healthcare is not just about doing tests on a patient and treating them, but it is also understanding their difficulties to come to the hospital and get the treatment possible. So here is where the coverage of the hospital, what we are looking for from Chamarajanagar till the BDD district. We want to cover the villages and the entire stretch by conducting medical camps, and the hospital acting as a hub for the management of these cases. So the population somewhere we are looking around is around 40 lakh population, which we will be catering from the Chamarajanagar till the Biddi district. So these will be mainly rural population and semi-urban population also, since our location of our hospital is at such a place wherein the villages and the town both are situated at our hospital's location. So the cost of the treatment in a hospital is basically dependent upon the manpower and the drugs and the consumables which are required for the treatment. So far 65,000 OPDs we have done for past 12-13 years, and more than 20,000 surgeries. Around 700 deliveries have been done. Amrita Kripa Hospital, being a satellite hospital of Amrita Hospital Kochi, is on that path towards giving the best possible treatment and technology to the patient at the most affordable cost. In our medical camps, whichever patient needs a higher consultation, we do that with the help of teleconsultation with our Amrita Hospital Kochi, wherein the specialists give their best of their advices, and it directly reaches to the patient through our medical camps.
Amrita Kripa Hospital, which had the birth in 2007, has been relentlessly and continuously conducting camps for the past 17 years. So today, being the 778th health camp telemedicine van, that is hospital on wheels, has reached a village which is almost 50 to 60 kilometers from the parent hospital. So what this health camp means to this village is screening of more than 135 to 140 patients are done, and their sugars, BP of everyone more than 40 years are screened. So after this, they are treated here with the free medications, asked to come for the follow-up in the next week with whatever problem they have. If surgery is to be done, the surgery is done free of cost. Government like Yashaswini card or Arogya Karnataka, the beneficiaries are treated. If they don't have anything, then also they are treated there with various surgeries, including the higher end laparoscopic surgeries and onco surgeries. So this hospital on wheels, going to the footstep, is happening in the deepest of the deepest area of the tribals. So they are not left then and there, they are picked up to the hospital and 1 month consultation freely done at our hospital.
ನನ್ನ ಹೆಸರು ನವ್ಯ, ನಮ್ಮೂರು HD ಕೋಟೆ. ನಾನು 10th ಪಾಸ್ ಆಗಿದ್ದು ನಮ್ಮ ಸ್ಕೂಲಲ್ಲಿ VTCL ಹೊಸಳ್ಳಿ. ನಮ್ಮ ಅಪ್ಪ ಅಮ್ಮ ಕೂಲಿ ಕೆಲಸ ಮಾಡಿ ಇಲ್ಲಿ ಸೇರಿಸಿದ್ರು. ನಮ್ಮೂರು ಒಂದು ಚಿಕ್ಕ ಹಳ್ಳಿಯಲ್ಲಿ ನನಗೆ ಸ್ನೇಹಿತರು ಯಾರೂ ಇರಲಿಲ್ಲ. ನಮ್ಮ ಮನೇಲಿ ನಾನು ಮತ್ತು ನನ್ನ ತಮ್ಮ ಇಬ್ಬರೇ ಆಡ್ತಿದ್ದೋ. ಏನಾದ್ರು ಆಟ ಆಡಬೇಕಾದ್ರೆ ಇಬ್ಬರೇ ಆಟ ಆಡ್ತಿದ್ನೋ. ಆಮೇಲೆ ಇಲ್ಲಿ ಫ್ರೆಂಡ್ಸು, ಅಣ್ಣ, ಅಕ್ಕ, ತಂಗಿ ಎಲ್ಲ ಬಂಧು ಬಳಗ ಎಲ್ಲ ಇದ್ದರು. ಆಮೇಲೆ ಇಲ್ಲಿ ನೋಡಿ ಕೋರ್ಸ್ ನೋಡಿ ತುಂಬಾ ಇಷ್ಟ ಆಯಿತು. ಆಮೇಲೆ ನಾನು ಇಲ್ಲಿ ಕಲಿತಾ ಇರೋದು ನನ್ನ ಫ್ರೆಂಡ್ಸ್ಗೂ ಸುಧಾ ಹೇಳ್ತಾ ಇದ್ದೆ, ನೀವು ಬಂದು ಹಿಂಗೆ ಈ ಕೋರ್ಸ್ಗೆ ಬಂದು ಸೇರ್ಕೊಳ್ಳಿ, ಚೆನ್ನಾಗಿರುತ್ತೆ ಅಂತ ಹೇಳ್ಕೊಡ್ತಿದ್ದೆ.
So, Amrita Kripa Hospital is not only catering the villages in the healthcare, but they are also uplifting the rural girls by imparting them education in the vocational healthcare sector. And this they are doing totally free of cost, even including their accommodation, food, everything is funded by the hospital. And with this they are getting cultural education, and after their studies is over, they are getting job in our hospital and as well as other places also. So this is the part which is the hospital is playing in the as part of a community upliftment thing.
ಹೆಸರು ಗಣೇಶ್ ಅಂತ, ಕೆಬೇಪುರ ಆಡಿ, HD ಕೋಟೆ ತಾಲೂಕು, ಮೈಸೂರು ಡಿಸ್ಟಿಕ್ಕು. ಇಲ್ಲಿಂದ ನಮ್ಮ ಆಶ್ರಮ ಶಾಲೆ ಸೇರಿ ಪುನಃ ನೆಕ್ಸ್ಟ್ ಹೊಸಳ್ಳಿಗೆ 10ನೇ ತರಗತಿ.
Behind me is the construction which is going on, as you can see, for the new hospital. It is a 66,000 square feet which can accommodate 100 patients at a time, and this will be ground plus 2 floors, wherein the ground floor will be accommodating all the diagnostics, OPD and casualty emergency treatment services areas. And the first floor will be having general wards, pediatric ward, then maternity ward, dialysis area. Yeah, actually this project was supposed to get finished by now, but due to tight finances we were unable to do so. And with the speed what we are doing the construction now, it should get over by end of this year, that is 2024 December. But it all depends on the support that we get from the philanthropic organizations. All the donations will be utilized to the best extent, which will be utilized for the free to concessional rate of treatment for the poor patients. So this is a humble request from our entire Amrita Kripa team to help the needy people who are really in need in our country, wherein the number of beds are very low as compared to the population. So the entire medical care is concentrated in the cities, and our hospital, since it is situated in the area wherein the villages start from this end, so this is we have a great opportunity and responsibility to cater our villages for whom this hospital is being constructed. Namah Shivaya.